Welcome to Penny Brawn UK's Introduction to Scar Care. This is the first in a three-part series created for Penny Brawn UK by Kate Oldham and by myself, Janey Barrett, both experienced therapists with a keen interest in scar therapy and holistic cancer support. Whether you're preparing for surgery, just finished treatment, or have scars that are decades old, this series will offer information to help you feel confident caring for your scars. There's often little guidance given post-surgery on how to look after your scars. We may be given a leaflet by the hospital about what to do if we get an infection, but often not much else. So this series is an opportunity to fill in the gaps and for you to learn how you can best care for and live well with your scars. In this first introductory session, we'll be providing an overview of what scars are, as well as looking at the physical healing process and how living with scars may impact on us emotionally. ScarWorks is a relatively new therapy. It was originally created in the States by therapist Sharon Wheeler and then developed in the UK in 2014. Kate and myself, Janey, both trained under Emma Holly, who is the leading expert trainer in ScarWorks in the UK. By definition, a scar is a mark left on the skin or within body tissue where a wound, burn, or sore has healed completely and fibrous connective tissue has developed. Within the cancer setting, scar tissue is not only the result of surgery, but also radiotherapy, PICC lines, ports, and epidurals. Therefore, not all scarring is visible, but they still follow a physical healing process. And in addition to all the healing and adjusting our bodies are going through physically with the scar, we also have a lot of healing, rebalancing, and adjusting to do at an emotional level. This series will be offering suggestions on how to care for our scars physically, as well as guidance and support surrounding the emotional impact our scars may have on us.
Scar healing process. Let's start at the very beginning, the wound itself. When your skin is broken, your body immediately jumps into action. This initial phase is all about stopping bleeding and laying down a temporary matrix. Think of it like a rapid response team. Over the next few days to few weeks, a delicate new tissue starts to form. This is where the initial strength is built, bridging on the gap of injury. It's a crucial time to protect the wound and allow it to do its vital work. A wound is still considered a wound until the scab has gone. So we need to be aware and look for signs of infection. As your wound heals, keeping an eye out for these signs of infection is absolutely crucial. An infection can signify delayed healing and lead to more prominent scarring. So what should you look for? Increased redness that spreads beyond the wound edges, warmth around the area, or any swelling that gets worse. If there's any pus or cloudy discharge, or increased pain and sometimes even a fever. If you notice any of these, it's important to contact your healthcare professional immediately. Early intervention can make a big difference. So the process of scar remodeling. Once the wound has closed and the scab has gone, the initial healing is complete. This is when the fascinating process of scar remodeling begins. This is a longer phase, often lasting up to 24 months post-surgery. During remodeling, the collagen fibers that form the initial scar tissue start to reorganize and become stronger. The scar will often change in appearance, becoming flatter, softer, and less red or discolored over time. This is where gentle care can really make a difference. Now let's talk about how you can actively support this process. Firstly, and perhaps most importantly, always keep your hands clean when working on scars. Before you touch your scar, wash your hands thoroughly with soap and water. This simple step significantly reduces the risk of introducing bacteria and causing an infection, especially if the scar is still relatively new. And please ensure you wait until the site is fully closed and there is no scab. Next, hydrating the scar is key. Once the wound is fully closed, and after your gentle massage, apply a gentle, unfragranced moisturizer. This can help keep the skin supple and promote flexibility in the scar tissue. You don't need fancy products. Often a simple cream is perfectly fine. In my opinion, I tend to stick to as natural a product as possible. I personally use organic rosehip oil as the beginning and then layer a moisturizer over the top, so I can nourish and moisturize at the same time. But there are lots of options, so choose what's best for you and your budget. When it comes to touching or massaging your scar, remember to work gently with your body, listening to its signals and never working into pain. Scar tissue can be really sensitive. Start with really light pressure, just a few minutes a day. As the scar becomes softer and less sensitive, you might gradually increase the pressure, but pain is always a signal to stop. Your body is telling you that it's just too much for it. The goal is to encourage the scar to soften and become more pliable, not to cause discomfort. Scar therapy is a very gentle approach, as we are working through the upper layers rather than the deeper layers of the skin. Be patient and consistent, and remember that healing is a journey, not a race. We often think of scars as simple marks on the skin, a visual reminder of an injury or surgery. But beneath the surface, a scar can tell a much deeper story. It's not just about what you see, it's about what you feel, and how those lines on our body can subtly, or sometimes profoundly, impact our daily lives. When our body heals after an injury, it lays down new collagen fibers to repair the wound. This new tissue, while strong, isn't quite the same as the original uninjured skin. It can be less elastic, less organized, and less forgiving. This difference is what leads to many sensations and challenges people experience. One of the most common complaints is a pulling sensation. Imagine a tight patch of fabric sewn into a stretchy garment. As you move, that patch pulls, restricting the natural flow of the movement. This can directly affect your range of movement, making simple tasks like reaching overhead after shoulder surgery or moving from the hips after abdominal surgery. Then there's itching. It's surprisingly common and incredibly frustrating. This sensation can range from a mild irritation to an intense distracting itch that impacts sleep and concentration. Scars can also play other tricks with our nerves. Many people report areas of numbness around a scar, while nerve endings may have become damaged during surgery or trapped during the healing process. Conversely, the area can become intensely sensitive, a condition known as hypersensitivity, where even the lightest touch can feel irritating or painful. That feeling of tightness isn't just superficial. A scar, especially a larger or more complex one, can feel like a band constricting the skin and underlying tissues. This tightness can contribute to a dull, persistent pain or even a sharp, intermediate discomfort, particularly with movement or changes in pressure. Also be aware that keyhole surgery will have a more significant impact than just the scar on the surface of the skin. Sometimes the body gets a little too enthusiastic with healing. This is known as overhealing, leading to raised, thickened scars like hypertrophic scars or keloids. A hypertrophic scar is characterized by an overproduction of collagen, resulting in a raised, red, and firm scar that remains confined to the original surgical incision site. Its healing typically involves an initial period of growth, often within weeks to few months post-operative, followed by a potential for spontaneous regression and flattening over time, sometimes taking 6 months to a few years to mature. The effects after surgery can include itching, pain, and if located near a joint, restriction of movement. In contrast, a keloid scar represents an even more aggressive overgrowth of collagen, not only raised and firm, but crucially extends beyond the boundaries of the original surgical wound. Keloids can appear later than hypertrophic scars, sometimes months to even a year or more after surgery, and unlike hypertrophic scars, they generally do not regress spontaneously. Their healing process involves persistent, unchecked fibroblast activity and excessive collagen synthesis. Post-surgically, keloids can cause intense itching, pain, tenderness, and burning. Their uncontrolled growth can lead to significant cosmetic disfigurement and, in severe cases, limited joint movement. Even with surgical excision, keloids have a high recurrence rate, often growing back larger than before. Now let's consider where the scar is located. A scar on the chest or abdomen, for example, might seem localized, but its internal pull can have far-reaching effects. If a scar from lung surgery or a mastectomy tightens across the ribcage, it can restrict the full expansion of the lungs, potentially leading to subtle or even noticeable breathing issues or shortness of breath. Similarly, abdominal scars from surgeries like bowel operations can cause adhesions, internal scar tissue that sticks to organs. These adhesions can pull on the intestines, potentially impacting digestion, leading to symptoms like bloating, constipation, or even more serious bowel obstructions in very rare cases. And for women, internal scarring can sometimes contribute to fertility issues by affecting the fallopian tubes or ovaries. It's a complex area, but highlights just how interconnected our internal systems are. But please remember, your scar is a testament to your body's healing power. It shouldn't cause or dictate your comfort or quality of life. And these things are things that we can work with.
How scars affect us emotionally. The story behind the scar, why you needed the surgery, for example, will most likely involve lots of feelings such as shock, disbelief, and extreme worry. And then when we find ourselves on the other side of the surgery and our bodies are having to deal with all the changes that have taken place, there may be a long physical recovery time and a sense of loss of self that may come with that. Not being able to do things as easily as before, and perhaps movement is drastically limited. And the appearance of the scar itself. It may take a while to heal, so it may look unsightly for a while. And even when it's healed, it may be that it's visible or in an area that makes you feel unattractive, or at least not like you. And pain can also have a huge drain on our emotions. When we're living with continued pain, it affects our sleep, which has a massive knock-on effect to our resilience and overall sense of well-being. And this whole experience can create a sense of overwhelm, a feeling of loss of control, fear, and concern related to recovery, to overall healing, and of what may happen next.
The prospect of surgery can be daunting, but empowering yourself with knowledge can make a huge difference. In this segment, we're going to explore a crucial question. How do we truly prepare our bodies for surgery? And what are the essential steps to take in those critical hours and days immediately afterwards? We'll cover simple yet effective ways to support your body's remarkable healing capabilities. Facing surgery can bring a mix of emotions. But what if you could actively participate in your own recovery, giving your body the very best chance to heal effectively? The truth is, how you prepare before surgery and what you do immediately after can make a profound difference. Let's explore some simple yet powerful tips to support your body through this journey. First up, nutrition. Think of your body as needing premium fuel for the intense work of healing. Before surgery, focus on a diet rich in lean proteins like chicken, fish, beans, and lentils, as these are building blocks for tissue repair. Load up on vibrant fruits and vegetables, essential for vitamins and minerals. And try and avoid processed foods, excessive sugar, and unhealthy fats, as this can help reduce inflammation and prepare your system. And always work with your healthcare team to ensure the diet is suitable for you and your body. Immediately after surgery, your body's demand for nutrients skyrockets. Continue prioritizing protein to aid in wound healing and muscle recovery. Small, frequent meals can be easier to digest. Also, listen to your body and your medical team's advice, as your appetite can vary. Sometimes gentle broths or smoothies are best in the initial days. Gradually transition back to solid, nutrient-dense foods. Hydration. Next, and equally crucial, is hydration. Water is involved in almost every bodily function, especially healing. Before surgery, ensure you drink plenty of water throughout the day. Well-hydrated tissue is more resilient and can recover better. Post-surgery, maintaining hydration is paramount. Anesthesia and pain medications can be dehydrating, and your body is losing fluids through healing process. Continue to sip water regularly. Your medical team might offer IV fluids initially, but once you're able, continue with clear fluids like water, herbal teas, or clear broths. Good hydration also aids our lymphatic system in waste removal and can help prevent complications like constipation. Skin care. Your skin is your body's largest organ and its primary protective barrier. Pre-surgery, follow any specific cleaning instructions from your hospital. Keep your skin clean and moisturized, and helps maintain its integrity by moving. Report any rashes or skin irritations to your medical team beforehand. Post-surgery. Proper wound care is vital. Keeping the surgical site clean and dry, following your nurses or doctor's specific instructions for dressing changes. Resist the urge to pick at those scabs or pull on your stitches. Once the wound is closed, the scar is gone, gentle massage will support the healing. You can also apply a mild unscented moisturizer, which can also help improve elasticity and reduce tightness. Protecting the healing area from direct sun exposure is also crucial to prevent hyperpigmentation. Range of movement. Finally, let's talk about range of movement. While rest is important, movement plays a key role in recovery. Before surgery, if appropriate and cleared by your doctor, maintaining your usual level of activity or performing gentle exercise can also keep your joints mobile and muscles toned, which can aid in a smoother recovery. Also, check how your joints move. For example, how does it feel reaching up through your shoulders, or how does it feel doing a sit to stand? Understanding our body and how it moves, doing simple day-to-day movements before surgery is really important. Immediately after surgery, your medical team will likely encourage early gentle movement, often starting in bed. This might include ankle pumps to promote circulation and prevent blood clots, or gentle movements of the surgical limb if permitted. Even small controlled movements can prevent stiffness, reduce swelling, and improve blood flow. This helps support the healing process. Always adhere strictly to your surgeon or physiotherapist's instructions on what movements are safe and when. Pushing too hard too soon can cause setbacks. By focusing on these 4 pillars, nutrition, hydration, skincare, and sensible range of movement, you're not only recovering from surgery, you're actively recovering better. Remember, your healthcare team is your best resource, so always follow their specific advice. And here's to a smoother, stronger recovery. In our last segment, we talked about the essential physical groundwork for recovery, fueling your body with nutrition and hydration, caring for your skin, and starting gentle movement. But true healing extends beyond the physical. Now we're going to do a deeper dive into how you can truly help yourself post-surgery, focusing on equally vital yet often overlooked aspects: your mindset and the power of gentle touch and exploration. Recovery is as much a mental journey as a physical one. Your mindset plays a huge role in how you perceive and respond to pain, discomfort, and the inevitable ups and downs of healing. It's perfectly normal to feel frustrated, anxious, or even a little low after surgery. Acknowledge these feelings, but don't let them take over. Instead, try to cultivate a mindset of patience and self-compassion. Celebrate small victories, like that first gentle walk, a good night's sleep, or even a small improvement in your range of movement. Engaging in gentle activities that bring you joy, like reading, listening to music, or light hobbies, can help you shift your focus away from discomfort. Techniques like mindfulness and deep breathing can be incredibly powerful tools to manage pain and anxiety. helping you stay present and calm. Remember, healing isn't a race, it's a marathon, and your positive outlook is a vital part of your recovery toolkit. Reconnecting with your body. Our surgical sites can feel alien, sensitive, and numb. It's common to want to avoid touching them. However, gentle touch and exploration of your healing area can be incredibly beneficial once your wound has fully closed. Start incredibly gently, perhaps just hovering your hand over the area or on an adjoining area. This helps to re-educate the nerves in the surrounding tissue and can help reduce hypersensitivity. As comfort allows, gradually progress to a very light touch, directly on the scar itself. Remember to have those nice clean hands. Use the pads of your fingers, applying minimal pressure. This isn't about deep massage, it's about reintroducing sensation and helping your brain to reintegrate the new part of your body. Over time, as your healing progresses, and with professional guidance, you can begin to gently explore the scar's texture and mobility. On our next video, Scar Therapy Techniques, this will support your learning and understanding simple techniques to support your connective journey. This mindful, gentle interaction with your healing body can help desensitize the area, reduce tightness, and improve your overall comfort and range of movement. Recovery is a holistic process, encompassing your physical body and your mental well-being. By nurturing a positive mindset and respectfully re-engaging with your healing tissue through gentle touch, you're not just waiting for recovery to happen, you're actively participating in it, empowering yourself on the path to feeling whole again.
The mind-body connection plays a powerful role in our overall health. With scars, a significant part of the healing process is beyond the affected skin and subsequent scar tissue. How we think and feel can influence how effectively and how quickly that healing occurs. Feeling emotionally stressed can increase body tension and slow down our healing, while a more positive mindset improves our immune system, supporting cell repair. Understanding our emotions, how we feel and experience them, is part of the healing process. By listening to our emotions, learning what they're telling us, we can start to live in harmony with our emotions, which in turn helps us to live in harmony with our scars. Reframing our mindset about the scar can be a huge part of recovery and healing. For example, rather than viewing it as something unsightly or painful, working at developing a mindset that relates to what an amazing job the scar is doing, having potentially saved your life by removing something that was causing harm and imbalance to your body. This mindset may feel quite ambitious right now and take a little time while you gently process what has happened and how it's made you feel. This can be achieved in lots of different ways. It's about finding the way that suits you. This may include talking to friends, having counselling, joining a support group, seeing a ScarWorks or other massage therapist, or perhaps using visualization, hypnotherapy, mindfulness, etc. All working towards the mindset that scars are not imperfections, they're signs of healing.
Thank you for watching the first video in our series dedicated to understanding and living well with scars. Today we've begun our journey by exploring what scars truly are, moving beyond the visible surface to uncover the intricate healing process and how they can impact our bodies. We hope this introduction has empowered you with a clear understanding of these unique markers of healing, recognizing how scars form and their potential effects. This is a crucial first step towards navigating their presence with confidence. As we continue this journey of understanding, we invite you to join us for our next video. In our upcoming episode, we'll delve into practical ways to support your body through gentle movement and massage, exploring how these methods can help release tightness and improve flexibility to enhance your comfort.